At the simplest level, cancer or cancer cells are cells that have lost the ability to follow the normal control that the body exerts on all cells. In our body, we have billions and billions of cells, and they have different functions. It's a very complicated process under incredibly phenomenal control. And if something goes wrong and that control is lost, then particular cells escape the normal control mechanisms, and they continue to grow, and they may spread. That's what we call cancer.
The most common cancers are breast, prostate, lung, bowel, melanoma, a kind of skin cancer, non-Hodgkin's lymphoma, kidney cancer, and head and neck cancers. But that's not the same as the main causes of cancer death. In fact, the leading cause of cancer death is lung cancer, followed fairly equally by breast and prostate cancer, with bowel cancer fourth. That's because even though some of those cancers are more common, they're more often successfully treated, so they have a better outcome. Some much less common cancers, particularly cancer of the ovary, the pancreas, and the gullet, are relatively uncommon in terms of how often they happen, but the likelihood of them causing cancer death is much higher because they often tend to be picked up quite late.
Stories like these emphasize how important it is to understand what causes cancer.
Research over the past 30 years has led to the discovery of exactly what causes cancers.
Mutations cause cancers. But what causes these mutations? 3 factors are responsible. First, random errors occur every time a cell divides and copies its DNA to make 2 new cells. This routine process happens millions of times every day in everyone's body and usually does no harm. However, cancers can occur when such errors, simply through bad luck, affect an important gene rather than an unimportant gene. Our research suggests that nearly 2/3 of the mutations that cause cancer are due to these errors, this sort of bad luck. The second factor is environmental. Some people add to the number of mutations in their bodies by their behavior, such as sunbathing or smoking. The third factor is inherited. Some people are born with mutations that make them more likely to get cancer.
A CT scan helps your doctor make a diagnosis, decide about what treatment you need, or find out if your treatment is working.
Hiya, nice to meet you.
This type of scan takes a series of X-rays and uses a computer to put them together.
And I'll come back to see you.
Before your scan, you may need to drink either half a litre of water or a type of dye called a contrast medium. This helps to make the scan clearer.
So you're going to feel a bit of sharp scratch.
Before most scans, you have a small tube put into your vein which connects to a drip containing the dye. Again, this helps to show up the inside of your body more clearly on the scan.
I need you lying up on the bed on your back, head on the pillow, feet that end, please.
During the scan, the bed moves in and out of the scanner. You may find it a bit noisy.
So shout if you have any problems. I'm just going to connect you up.
As the drip goes in, you'll probably get a metallic taste in your mouth, feel warm, and you might think you are passing water. You're not.
Just close your eyes, please.
These feelings pass quickly.
Okay, you can open your eyes now. I'm going to be doing the scan shortly, all right?
The radiographer controls the scan from a separate room.
Table moving.
The CT machine takes pictures of your body from different angles and builds up a series of cross-sections. This creates a very detailed picture of the part of your body being scanned. Most scans take just a few minutes.
Okay, that's all finished.
The whole thing takes about 90 minutes, and you usually get the results within a couple of weeks.
Medical decision-making is an important part of the process for any patient with cancer. And this is very important because it involves both the patients, the caregivers, and their clinicians. Clinicians have different expertise. They understand more about the treatment, the nature of the tumor, the side effects of therapies. But patients know themselves. They know what their health is like. They know what their personal preferences are for treatment. And so this collaborative process is really important as we come to making decisions about treatment.
in everybody's body there are cancerous cells. They consume usually about 27 to 28 times of food. An ideal spacing between one meal and the next in the yogic culture is 8 to 12 hours. If you space out 8 hours meals, you will see the cancerous cells will all die by themselves, and once in a way, every month, twice a month or once a month, people are practicing one full day, no food. These are simple ways to control this.
But the tongue and tonsillar area is a very hard area to get to.
Dr. Eric Moore says traditional surgery often involves splitting the jawbone open to access the tumor.
And obviously that's disfiguring, interferes with their speech and swallowing, takes a long time to recover.
So instead, Dr. Moore used a robot to remove Roger's cancer. The operation involves lowering the robotic equipment through Roger's mouth to the site of the tumor. While seated at the control panel, Dr. Moore then guides the robot as it removes the cancer without damaging surrounding structures.
Hi, I'm Ashley, physical therapist with the Marshfield Clinic. Today, Jill is going to demonstrate a sun salutation flow. Start in mountain pose. Take a deep breath and sweep your arms up over your head. Exhale, circling your arms down to your sides and behind you. Inhale, linking your hands behind the small of your back and opening your chest. Exhale, bend to forward fold. Move into downward facing dog and hold for a breath or two. Move into plank and hold for a breath or two. Lower to four-limb staff, holding for a breath or two. Fully lower to corpse pose. Inhale, push up to upward facing dog. Exhale, reverse to corpse pose. Inhale, push up to upward facing dog. Exhale, reverse to corpse pose. Inhale, push up to upward facing dog. Exhale and push back into hare pose. Inhale, push up into cat pose. Exhale into cow pose. Inhale into cat pose. Exhale into cow pose. Inhale into cat pose. Exhale into cow pose. Inhale into hare pose. Push up into downward facing dog. Step forward left, right, into forward fold. Return to mountain pose, bringing your hands to the center.
We all know that we should be exercising. Inactivity is one risk factor for heart disease, cancer, and stroke that we can take control of and do something about. Current guidelines recommend that Canadian adults exercise for 30 to 60 minutes most days of the week. The good news is you can accumulate this activity throughout your day. 10 minutes in the morning, 10 minutes at lunch, and 10 minutes in the evening can help you reach this target. There are many benefits of exercise. It can decrease your blood pressure, your cholesterol, your blood sugars. It actually helps to increase the efficiency of your heart and lungs, and it will just give you a greater sense of overall well-being. There are 3 types of exercise you should include in your program. The first is endurance. That's the walking, the swimming, or the cycling. The second is a strength training component, just to help increase the strength of your upper body. And the third is flexibility or stretching, just to help increase the mobility of your joints. You should start off slowly with achievable goals and gradually increase your exercise each day, but most importantly, just find an activity that you enjoy doing and get moving.
You're probably familiar with foods that aren't good for you, such as those high in refined sugar and flours, as well as saturated fats. These can increase your levels of inflammation in the body, which may contribute to illnesses such as diabetes, cardiovascular disease, and certain cancers. So the best health foods are the ones that may help squelch harmful inflammation. Here are some top picks to put on your plate. Number 1 is eye-popping produce. Certain fruits, especially those that are jewel tone in colors like blueberries and cherries, contain compounds that have anti-inflammatory and antioxidant effects. The same is true for the vibrant reds of tomatoes and peppers, the vivid oranges of mangoes and squash, and the gorgeous greens of broccoli and spinach. Number 2 is zippy spices. Flavor enhancers like ginger and garlic double as anti-inflammatory agents. Number 3 is fill you up fiber. High fiber diets have an anti-inflammatory effect too and help protect against heart attack and stroke. Great sources of fiber include beans, whole grains, fruits, and vegetables. Good fats are number 4. Cold water fish, such as salmon, flaxseed, and walnuts, are good sources of anti-inflammatory omega-3 fatty acid. These good fats may reduce the risk of cardiovascular disease and Alzheimer's. For dessert, sip green tea and indulge in dark chocolate, in moderation of course. Both are rich in healthy antioxidants. I'm Dr. Natasha. Bon appetit and live well.